Health Novo presents Sushruta, our health awareness channel.
Hi moms, today we are back on Child and You for a special session with a pediatric ophthalmologist, Dr. Deepak Garg, a very close friend and a colleague of mine with tremendous amount of experience in kids' eyes. I'm Dr. Nihar Parekh, and today we're going to embark on a special journey that deals with your kid's eyes. When to get his first eye checkup done? What are the common problems? How do I know my kid has numbers? We're going to tackle these issues one by one so you're a smarter and a happier mom. So, today we're going to start our journey with the newborn. And when the mother comes to us for the first time with the prettiest thing on earth, that's his or her newborn, they're concerned about skin rashes, reflux, weight gain, and the kid's eyes is the last or the least priority. But we still insist at pediatricians that as newborns, they should get their eyes checked. Dr. Deepak, why is it that important for a newborn to have its eyes checked?
Nihar, that's a good question actually. Newborns should get an eye exam. Most of the newborns are examined by their pediatricians itself. And they use an instrument which is something like a torch to basically see if the red reflex is coming back from the eyes. What this examination does, a newborn eye examination, is to rule out not very common but not so good eye problems like a cataract. Cataract in children is not very common, but it is a very big problem because the child's vision is severely hampered. Of course, there are other problems too that can happen in newborns, but they are even rarer than a cataract. So I think if a pediatrician does an eye examination for a newborn with a torch-like instrument, I think a big job of a newborn eye examination is actually done, and that's what is required.
That's fantastic, Dr. Garg. This information is very important so that you don't take your newborn's eyes lightly and miss something that is very rare but very important to diagnose. One more thing. How about premature children? The vision of premature children, how important it is to keep a check on it, how important it is to make sure we do the right treatment at the right time in premature children. Can you throw some light on this particular issue?
Nihar, that's an excellent question. Normally what happens is that the retina, which is the back part of the eye, something like a film of a camera, grows or reaches its final stages of development in the last month of pregnancy. Now, if we have a premature child, then that part of development which happens in the last month has not happened in the uterus or in the mother's womb. If a premature child is thus born, it is very, very important that that child gets a retina examination by a pediatric ophthalmologist or a retina specialist where the pupils are dilated and the retina is examined. Retinopathy of prematurity is the name of the disease that we are trying to detect. Many a times, the retinopathy of prematurity, even if diagnosed, is not really treated and is observed for the first few weeks, maybe a month, and everything is all right and the retina develops normally. However, sometimes the ophthalmologist may need to treat the disease by doing certain lasers and, of course, very rarely by doing surgeries. But what is most important to remember is if a premature child has retinopathy of prematurity and is examined in time, then there's a very high chance that the child will have normal vision, and therefore it can be treated very well if detected in time.